Well, today is not my working day and neither I'm at home. Well, it's just like a me time because stress is everywhere, whether you're at work, whether you're home. And stress contributes to a lot of things in our body, especially our health, our mental health. But as a dentist, I can say the mental and dental are not far away from each other. We see the signs and symptoms of stress in the patient's mouth as well. Most importantly, we see them grinding their teeth, clenching their teeth. We see their oral health deteriorating because we see their gums bleeding because your immunity suppresses itself if you're stressed. So we see a lot of gum problems happening in the patients who are stressed. We see lots of ulcers happening in the patients who are stressed. Sometimes they neglect their oral hygiene, and because they neglect their oral hygiene, they binge into eating sweets and all sort of, these comfort food, and that also contributes to a lot of cavities and dental related issues. So if I say stress, we see that how stress is causing problems to my teeth. But stress is a major contributing factor in the patient's bad oral health. So managing stress really helps in managing their dental health as well.
So what is bruxism?
Well, bruxism is an involuntary activity of your jaw muscles where you grind and clench your teeth. There are two types of bruxism. One is a sleep time bruxism. So you do that while you're sleeping and you are totally unaware of that. And this is an unconscious habit that we develop because this is a body's response to suck the jaw when we are stressed. And you do that when you're superbly stressed. You do that while you're sleeping and then it becomes a habit. The amount of pressure that we apply by grinding or clenching our teeth is nearly 20 times more compared to the pressure we apply while eating our food. So imagine the amount of stress our jaw bones, our jaw muscles, our teeth are going through when we are grinding our teeth. So that's called as bruxism. Another thing is we do that while we are awake. So when we are awake, we clench our jaw because we are exercising, we are stressed, we are overthinking. That also becomes a habit. So the bruxism is the involuntary gnashing your jaws, clenching your jaw, which affects the teeth, facial muscles, jaw muscles, and everything in head and neck area.
What are the main causes of bruxism?
Well, the causes of bruxism, there's not one cause of it. The main cause is the stress, which triggers bruxism because when you're stressed, you tend to clench your muscles. And these jaw muscles, especially your masseter muscles, is one of the very strong muscles of your body. And it has a lot of power. So when you're stressed, you are anxious or you're going through a phase. So then when you start causing this grinding and clenching to yourself. Another thing is the sleep disorders. If somebody is dealing with sleep apnea or sleep-related disorders, that also contributes to sleepless nights or developing this habit of being stressed while you're sleeping. It is genetical as well. Many people don't know, but this also runs in the families. Many neurological disorders like Parkinson's disease can also contribute to this involuntary activity of grinding or clenching the jaw. Some medications, especially the antidepressants or the medications taken for ADHD, has got a side effect of leading to this hyperactivity of the muscles. There are a few contributing factors which can develop into this lifelong habit of bruxism.
And what are the symptoms of bruxism?
Well, mostly the patients are not aware of bruxism because they do it mostly while they're sleeping. But when you wake up and you feel a stiffness in your jaw, and if you feel a stiffness in your neck, your facial muscles, you have a headache in the morning, you feel like you have a difficulty in opening and closing of the jaw, if you see one side of both sides of your face are hurting, and you're having this facial pain for unknown reason, mainly in the mornings if you're doing it while you're sleeping, or it is getting worse maybe in the evenings if you're doing it while you're awake. So that is the first sign that the patients usually notice. In dentistry, what we see in the patients is the regular chipping of enamel. We see that for no reasons their enamel, the edge of the enamel, the front teeth or the back teeth, they are chipping because you're grinding and clenching your teeth enormously. In the soft tissues, we see an indentation, a line around the tongue on the corners of the trunk because mostly the tongue rests in the middle of the teeth. So if you're grinding and clenching, you have the marks of your teeth on the side of your tongue. You also get a line across your inside lining of the cheek, what we call the linear alveoli. So you can feel it with your tongue as well. There is more gum recession. There is more chipping of the fillings, failing of the dental work, neck pain, etc. So there are a lot of factors which the patients can recognize that when they start to grind or clench their teeth. Sometimes we feel that nothing has changed, but why am I having this abnormal sensitivity? Why my teeth are breaking away? So stress and bruxism is one of the things that is leading to all these problems.
And how does bruxism start?
Well, the bruxism mostly starts when you are stressed about something. And when you're going through an anxiety phase, let's say a breakup, your exams, work stress, etc., because your jaw muscles has got this habit of squeezing when you're stressed. And when you're stressed and you're constantly thinking about it, and that's developing inside your brain, you're even thinking before you're going to bed. So your subconscious mind or your unconscious mind is still holding on to that stress. And you release that in the form of squeezing yourself, squeezing your whole body, including your jaw muscles. And the jaw muscles being very powerful, squeezes the jaw together. And you start developing that habit, because when you are doing the grinding and clenching while you're sleeping, you do it in a stage called as non-REM stage. That means you're not fully asleep then, you're not in that rapid eye movement stage of sleep, but you are in that stage just before that, and which leads to rapid arousal. That means you're waking up, then your brain wants you to go back to sleep, but that response is like a stress because you're waking up disturbed in your sleep. That triggers clenching again. So you're forming that circle of waking up because of the clenching, and then clenching leading you more stress, and you're clenching again. So it's like a vicious circle that forms. So mainly it's the stress that leads to the situation. Some patients go through the sleep apnea, and they relate to the phase when they had sleep apnea, and they start becoming more into this grinding or clenching habit. Some patients start to develop this habit while they have some medications or some change of medications like antidepressants, anti-anxiety, or also ADHD medications. And sometimes it runs in the families. So there's no one trigger for that, but the prime trigger for bruxism or clenching is the stress.